symptoms of epilepsies depend on which part of the brain gets activated in the epileptic process. So the point of origin of the seizure is called the ictal onset zone, where the seizures, the electrical sparking, arises from the brain. And as it spreads, it leads to a spectrum of symptoms depending on how the current travels in the brain or which areas are involved. And that is known as the symptomatogenic zone, or what symptoms happen during a seizure. For example, if somebody gets seizures originating from the motor cortex or the frontal area, here what happens is you get a typical shaking kind of movement, what we call as a Jacksonian march. And if the seizures arise from the inner part of the temporal lobes, what we call as the mesial temporal lobe, there can be a variety of auras. Auras are simple partial seizures, or the initial part of the seizure which somebody has awareness about. And auras can be of different types. You get something coming up the abdomen called the epigastric rising sensation. Somebody can get an abnormal smell. People can have various experiences like déjà vu, where you feel that the same thing has happened before, or jamais vu, where you feel you're in a very unfamiliar circumstance. There can be intense fear if the amygdala is involved. And if the seizures originate from the occipital cortex, you can get various kinds of visual symptoms like visual hallucinations, seeing colors, objects, change in images. So these are some of the auras which happen depending on which area of the brain cortex is involved. And some people get ascending symptoms like crawling sensation or tingling sensation if the parietal cortex is involved, or if the insular cortex is involved, or if the supplementary area of the brain is involved. Now, as the seizure progresses, there can be loss of consciousness. In some instances, if the seizure is very rapid or if it involves both sides of the brain, there's generally loss of consciousness. And in patients who have generalized tonic-clonic seizures, there also the consciousness is lost. Now, seizure is generally recognized as a generalized violent movement. It's called a generalized tonic-clonic seizure. And it can be of two types. Either the whole brain gets activated in the seizure process right from the beginning, where it's called as a primary generalized tonic-clonic seizure. This happens with many of the idiopathic or genetic generalized epilepsy syndromes. Or it can be a secondary generalized epilepsy or a focal to secondary bilateral tonic-clonic seizures, wherein the seizures originate from some part of the brain and then spreads to cause a bigger seizure. Now, in some types of seizures, like for example the myoclonic seizures, you just get sudden jerks like this. If you have something in your hands, you throw the objects out. If you're standing, you may just have a jerk in your leg and fall off. And here usually the consciousness is preserved. In other types, you have sudden loss of awareness or loss of consciousness, known as absences, where nothing happens. You're just stuck like a statue. So this is called an absence seizure. Typically, absence seizure happens in children and lasts, say, for about 10 to 60 seconds and tends to happen several times in a day, and typically gets worse with running or breathing fast. And then the other type of seizure is called a focal unaware seizure, what was previously known as a complex partial seizure, where seizure typically arises in a focal region of the brain and then spreads, leading to loss of awareness and various kinds of symptoms like automatic movements. For example, lip smacking movements. You do this kind of movements, or people rub their hands or sometimes wipe their nose. So these kind of movements can happen in complex partial seizures, particularly of the temporal origin. There can be abnormal twisting of the hand. Seizures, if they are spreading, you can get head adversion to one side. And sometimes some seizures you can get a mild, we call ipsyawareness, where the head is slightly tilted, where it goes to the same side of the seizure, or it can be fully turned, called the versive seizures. So these are some of the symptoms of epilepsy. And if somebody is standing, there's a risk of the person falling down.